vital movements. We're going over the first exercise of the top 3 exercises to help dental professionals get out of pain, work and live pain-free. All right, we're going to change the way you move. The first exercise is the hip hinge, okay, which is forward flexion from the hip joint, okay, where the femur meets the acetabulum. Forward flexion being this movement here. Now, what I tend to see in practice is a lot of dentists and dental professionals working and leaning forward or flexing from the spine, okay? Leaning forward, flexing from the spine, as opposed to what they should be doing, which is forward flexion from this big joint here, the hip joint, okay? This joint has a lot of big muscles that are far more capable of the task at hand. You are in this forward position for a long period of time throughout the day, up and down, and the lower muscles, the muscles in the lower back are not capable of maintaining this position for long periods of time. So what we need to do is change the way your body moves. This forward flexion of the hip joint used to be the main movement pattern you used to lean forward or flex forward, but we lose it at a very young age, watching our parents do the wrong thing. So what we need to do is reinstate this movement pattern to become the main movement pattern again. So this exercise is extremely important and needs to be mastered by everybody, especially dental professionals. Okay, so what we're going to do is we're going to look at the exercise in a way that you need to think about it. You need to think about what's happening with your body. There's no point doing the exercise. The exercise must be done with a lot of intent, a lot of thought. All right, so think about this exercise as the drinking bird. As you can see here, the drinking bird is the bird that leans forward, moving from one joint alone with a straight and stable spine. I need you to do the same. Whilst doing the exercise, it's important that you hold on to the pelvis and you're going to direct the pelvis with your fingers, okay? So what we're looking to do is move from that one joint and that one joint alone. Let's get through and take a look at the exercise. You need to master this exercise in an exercise or gym setting before you can take it across and use it successfully in practice and the rest of your life. It needs to be mastered and practiced daily. Daily. I can't stress how important this movement pattern is. So let's get through, take a look at the exercise. Loop from Vital Movements. We're going over the hip hinge with wall assist today. We're going to take our hands, put them on our pelvis, maintain cocan. As we go down, keep that cocan in line where the pelvis stays lined up with the rib cage. Push your femurs back and up. All right, so we're going to use the wall to give some more assistance. So you want to stand about yay far from the wall to begin. Your aim is to give that wall a nice kiss. If it's super easy, come out a bit further. Keeping your back nice and straight. We reach up on the wall with our backside. You should feel a lovely pull in those hammies. Big kiss. And back out. So remember, with the hinging, always keeping things in a line, nice and long through the body, as though someone's pulling you from the top of the head. All right, that's how you hip hinge with a wall. Now you've given that a try, it's important to remember, this is an exercise pattern that you start standing, eventually you will take seated whilst working. It needs to be mastered in that gym exercise setting before it can be taken successfully through. It's an exercise that needs to be done at minimum 3 times per week, 3 sets, 10 to 15 reps, but you could comfortably do this daily, even twice daily. Okay, so it's starting with no weight. Later, as you get very familiar with the movement pattern and it becomes much more automatic, you can add weight and we can advance the exercise until you can strengthen the muscles that help that facilitate the movement pattern, and then you will find your lower back will not get so tired. You will not be overusing those muscles. Inflammation and pain will go away from the lower back just by nailing this movement pattern. All right. Now, this is number 1 of the top 3. Get through and check out my next videos, number 2 and 3, which are for spinal rotation and the correct movement pattern that will maintain and move your shoulders to hold your hands in front of you whilst you're working.